Hi guys, welcome to Next Kelvin TV. My name is Nesty. Today we are going to learn about administration of IV medication, Ampoule. So here is my patient, Mrs. Augustina, and one of the patient patients. So guys, stay with us. Before we start the procedure, we have to explain the procedure to the patient and then also establish our home. Mrs. Augustina, good morning. I'm your friend Nesty. Send a young time on the brown said you want to know. I grew in the Before team. So I have online number for finding a done it. But in the civil service, I said, I need to be a number. So the down but your mom finds it. So guys, I'm done with explaining the procedure with my patient and then also establishing rapport. And then with the many amounts of ABBA, I have to check for the right patient, right medication, right time, and then the right dose. Mrs. Augustina, but you're within sanity. So this is Ampoule. You will check on the PC. So Ampoule furosemide 40 milligram. Then you check the expiry date. Check the right time. Okay guys, my check is right patient, right medication, right time, then the expiring date of the drug name. So my check is every. So guys, I'm done with the second chest. Into first checking, we're checking up nursing station. Ube PC ne so no I dey no check. Nti ube do patient no nchen a wabo ni din no cross check e dro no any ni din any time obeje no any dose. Right time, right patient, right medication, and then the right dose. So when you are done with the second check, then you assess the site of the cannula, whether you see there is redness or there is infiltration. Then we have to massage it. So if there is infiltration, that's why I made a tourniquet and then cannulas and so by. If there is infiltration there, then we have to remove the cannula and then your whole life for Friday. I'm a patient. But you are okay. So I have assessed the patient's site of the cannula. I do some of the marking touch. About two patients in the bed. This is what I'm about to pick up. So guys, I'm withdrawing the medication. That is Ampoule furosemide 40 milligram. And the ube shaking a kakra. And now, say lie be a day. At that amount, Ubebu ni say, yenye ni say, Ubu ni say. Iti Ubebu ni say, Ubebu aba say, Umunku say. Then you withdraw the medication. We are be shaking kakra no splitting in case the woman. So guys, I'm coming to wear the sterile glove. So I'll do the third check of the medication, the right time, the right dose, and then the right patient. That's all, Mrs. Augustina. So I'm done with the third check. So you have to check the patient name, medication, time, and then the dose. Mrs. Augustina, then you have to apply the push stop techniques for 15 to 30 minutes. Before administering the medication, you have to also withdraw. After maybe a clot or one. And some pushing medication slowly. Push stop technique for 15 to 30 minutes. So assume it's 30 minutes in higher there. So my man medication higher there. I close. And you have to educate the patient about the medication, the side effect. Mrs. Augustina, I don't know the amount. Once I buy an apple pressure, I had also kaka. One pressure, I had a from kaka. And I feel so. Side effect, I want to say, Oba Johnson 10. So it is a who is a baby, and I say, be a phone, and I say, be our Nisu Biwa. Yes, if you are doing engagement, a year, but the side effect I had also at your address. So it is maybe so. Then before then you have to wait for 5 minutes to see if there is any immediate reaction there. Then you have to find out. Over train with patient bedside for 5 minutes and sign away the work. Okay. Then you thank your patient and then you move your trolley, you document, and then wash your hands. Then 30 minutes later you come and check if there is any side effect and answer there is any adverse reaction here, then you have to find out. So thank you for watching us, Kelvin TV. Keep on subscribing to us, Kelvin TV. Thank you. Bye-bye.